With coronavirus around the globe now, I think it's more important than ever that we separate the information from the misinformation on what's actually going on, the response, what we actually know. And joining us now to help do that, Dr. Shweta Chakraborty, risk and behavioral scientist on EcoHealth Alliance's Leadership Council. Welcome to the show.
Thank you for having me.
Very glad to have you here. So let's go broad brush for now. In comparison to some other cases, SARS, bird flu, swine flu, all of those sorts of things, how serious is coronavirus right now?
So we really need to put this in context. COVID-19, the new name, the mortality rate for this virus is still far less than all previous health emergencies that you just mentioned, like SARS. And even with the new death toll reaching well into the 1,000 plus, and the infections, the transmission and the rate of transmission that's increasing, I can understand how this can be alarming. But in context to these other public health emergencies, it's still, we need to recognize that the seasonal flu in the US alone has still killed tens of thousands already and continues to annually. So the seasonal flu still remains a greater present risk for those outside of China. China's measures, although many credible authorities, including the World Health Organization, has said it has been too stringent, it can be credited, though, for delaying the spread of the disease. And this is really important for the international community to give us time to develop immunity, to look into vaccine, to look into treatment protocols. Basically, it's buying time to better understand how the virus moves, if it moves through populations.
Every time I hear about how many people die from the seasonal flu in the United States, I manage to forget it afterward, and the numbers are just so amazing. But can you help us to differentiate this coronavirus, or the COVID-19, as you say, versus like a regular seasonal flu? What are some of the important distinctions between those?
So we could say that COVID-19 is like a bad flu. It's unlikely to be a lethal pandemic. The seasonal flu does have a rough start and end date, and so that is one significant difference between the two. We see that the seasonal flu tends to favor colder weather for transmission. And there's a variety of factors why this might be the case. Perhaps because people are indoors and they're interacting more. That seasonality for transmission may be true for COVID-19, but that's not something we know yet. That's something we still have to wait and see. Ultimately, COVID-19 will be one of these infections that we'll learn a lot from. It's something that has been potentially known to emerge for quite some time. And it's not just this particular infection. There's potentially 1.67 million viruses out there that could emerge. So it's gonna be really critical to differentiate this from the seasonal flu that we understand, and to see how it really is different, to give us some insight into additional viruses that could develop and emerge in the same way that this one has.
And so, look, we were doing research and we saw that apparently about 11,000 people have been infected with it and have since recovered, although we know that there's not a cure yet, and they haven't finished the actual vaccine that hypothetically would stop this in the first place. So how are they actually recovering?
In the same way that you would handle your immunity, your own immune system would combat any type of intruder to your body, is essentially how your body is fighting off the coronavirus. So this virus is really problematic for those who are vulnerable, younger populations, although it doesn't seem to have the same effect in children as even the seasonal flu does. It's kids up until now seem to be more protected than say those who have more vulnerable immune systems, those who have underlying conditions, those that are elderly, women that are pregnant. So these are the types of communities and demographics that we're more concerned about in terms of being able to fight off the virus on its own. But we're gonna learn a lot as we see this virus move its natural course. And that's what's so critical to remember, is that despite these delay tactics, despite the measures that have been put in place, quarantines and evacuations, that's really just affecting a few hundred thousands of people, where this virus is already out there. China's several weeks ahead of us. And the virus, remember, was out there without us having any indication that we knew anything about it. And so we're gonna see it run its course. And these measures are really going to end up being neither here nor there. So we'll have a much better understanding about how this virus moves through populations, whether or not there's community transmission, to the extent that that's the case. So then we'll be better prepared for it if it persists or if it reemerges in the future.
I know that in past cases where there's been the concern about a pandemic, that can be an opportunity where misinformed people can spread things that are not necessarily true. There can be the intentional sort of using this to spread misinformation. So I want to talk a little bit about that. First, with potentially good actors. So have you noticed anything in the way the media has been talking about COVID-19 since the initial reports until now, where they might be fundamentally misunderstanding something about either the disease, the response to it, how this is likely to play out?
I would definitely say I'm disappointed in that we haven't learned from so many viruses before us that have targeted specific regions from which they've emerged, or specific communities from which some behavioral practices resulted potentially in the outbreak of a disease. Like Ebola was unique to Africa, SARS was unique to China prior to that. The reason naming these viruses are so critical is to take away that stigma and that attachment to particular behaviors and communities and regions of the world, to try and reduce potential xenophobia and unnecessary stigmatization of certain populations of people. Because really, this is an education and awareness exercise, and we should have learned from the past. And yet we're still seeing the same types of language being used in the media, perpetuated through the media. The same type of learning hasn't occurred, or the type of learning that we would hope for that we would have happened post-HIV. And post-SARS, post-MERS, which came from the Arabian Peninsula. These are things that we should have progressed past. And we should recognize that those bad behaviors that are resulting in potential outbreaks need to be addressed, but should not be used against a particular community of people. So that is something that we need to address now going forward, because inevitably another virus will come, and it can come from anywhere. And we need to globally and collectively learn what we did wrong in the past so that we can just mitigate against its spread, contain it, and react if we need to. But this education and learning should result in more proactive measures. We should stop these viruses from ever breaking out in the first place.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.